So this session we have Professor Li-Meng Zhi, who is a consultant physician and the past superintendent of Taichung Hospital, Ministry of Health and Welfare. And the next one is Professor Huang Guojing, who is a vice superintendent of National Taiwan University Hospital. Let's welcome these two moderators.
Thank you. And I'm Dr. Li, and next to me is Professor Huang. We are great honor to be the moderator for this session, a very interesting and also important session. And I would like to introduce our first speaker, Anjali Wei-Ming Zhang, doctor, and she graduated from University of California for her PhD and then a postdoc at the University of Michigan. And now she is an associate professor and also executive director for the Center for Aging Research and Education DUS, National University Singapore Medical School in Singapore. And this afternoon, she's going to give us a talk on a very interesting topic. We already have many interactions before her speech is investigating the impact of loneliness on hand grip strength among older men, women in Singapore. Let's welcome Dr. Zhang.
Thank you very much, Dr. Lee, and thank you to the National NHRI for the invitation. I feel like saying now for something completely different because, like I said, I'm a sociologist, but I'm very interested in biology of aging. And I think one of the reasons that I'm here, and I'm really happy to be here, is because oftentimes social sciences don't talk to biologists. And I think in terms of aging, we need to have more conversation and be more interdisciplinary. So today I'm going to talk about loneliness, which is a very big issue in many countries, many developed countries, and hand grip strength, and some initial results that we found by gender. So loneliness has gained attention in recent years, and actually on the 15th of November this year, WHO announced a new commission on social connection to address loneliness as a pressing health threat, promote social connection as a priority, and accelerating the scale-up of solutions in countries of all incomes. And some of the members include the US Surgeon General and the Japanese Minister in charge of measures of loneliness and isolation. And the United Kingdom also has a Minister for Loneliness. In Singapore, we, I think, are on the way. But globally, 1 in 4 older persons are lonely. So how do you define loneliness? Well, way back in 1982, Peplau and Perlman were one of the first to create this definition. And they said it's a distressing feeling that accompanies a perceived discrepancy between one's desired and actual social relationships. So this is the definition that I'm using for loneliness today, and I'll talk about how we measure it in a minute. One of the things Dr. Lee said I must do is to say that loneliness does not equate with social isolation. So you can be lonely in a crowd, and you can be living alone and not lonely. So that is one of the distinctions that I wanted to make today. And loneliness does not equal depression. They're correlated, pretty highly correlated, but they're not the same thing. So why is loneliness important? Well, because social relationships or the lack of, are as bad as smoking a pack of cigarettes a day, having high blood pressure, being obese, and low physical activity. So a lot of times, loneliness is overlooked. It's never something that information that doctors collect in clinic. But we found that 75 of readmissions in hospitals are due to social causes. And in Singapore, about 39% of older adults report being lonely. And this is from a study of 5,000 older people in 2016. A recent paper we published on healthy life expectancy shows that loneliness decreases total life expectancy by 6 years, and it decreases active life expectancy by 3.4 years. One of the things about healthy life expectancy I wanted to add in here, because I'm a demographer, when you look at Singapore and Japan, we are 1 year difference in terms of healthy life expectancy. But healthy life expectancy is calculated on a life table, and it goes from 0 to 80 plus. The reason that Singapore has increased its healthy life expectancy so dramatically is because we decreased maternal and infant mortality, and we're better managing NCDs. However, if you calculate healthy life expectancy at age 60, we are not doing so good, and neither is Japan. If you calculate the number of years you'll spend healthy from 60 onwards, you can expect to spend 12 years of that time, and average life expectancy is 84, 85 years, unhealthy. Because healthy life expectancy is calculated the number of days you spend disabled. So I think that's one thing that people sort of overlook when they think about healthy life expectancy, and like it looks really good for the country. But if you look at older people and calculate, and it's starting at age 60, the picture is not as rosy as we think. And what we've been finding in Singapore is, the government always says the family is the first line of support. And there's a lot of incentive to live with family, tax incentives, priority in the queue. But it's not equal to good psychological health. In fact, you'll see later on that people living with children are more lonely than older people that live with a spouse alone only. So currently in Singapore, we're actually focusing on programs to increase social engagement. So the government just put in another 800 million, I think, into developing social programs to get people out of their homes. And at the moment, there are no evidence-based interventions for loneliness in Singapore. So this is what I wanted to show you, and it relates back to Dr. Lee's comment about you can be with people, like with a child, and you can, 28% of these people who live with a child only are mostly lonely, and 25% are sometimes lonely. And you can see that living with a spouse, there's a huge difference in the percentage who are mostly lonely compared to those living with a child without a spouse. So spouses are very important. So in 2015, we looked at mortality and loneliness using a longitudinal data set. We had 3 waves of data, and we found that even controlling for living arrangements, social networks, health status measured by presence of disability, activity of daily living limitation, and number of chronic diseases, that loneliness was still associated with a greater risk of death. And one of the things that I'm looking at now is the fact that not all lonely people are the same. And the reason that's important is because if we want to develop interventions for lonely older adults, we need to take this into account. So for example, you can have, this is the scale for loneliness. This is low, and this is being very lonely. And you can see that people who are very lonely have very low levels of personal mastery. That means control over their lives, they think. And they also have high number of depressive symptoms, and their social networks are moderate. And this is different, for example, to someone who's not lonely. They have high levels of personal mastery, moderate depressive symptoms, weak social networks. So there's something going on, and we're trying to develop archetypes of lonely older adults. So I think one of the reasons I was invited here was to talk about the longitudinal cohort that we have in Singapore. And in 2015, our Ministry of Health commissioned the center to run a nationally representative study on productive and active aging. We call it the SIGN study. And the aim was to monitor and track changes in lives of older Singaporeans. And the focus was really on physical health, function, social engagement, lifelong learning, volunteering, and psychological well-being. So 2015 was actually a turning point in Singapore, where they put out an action plan for successful aging. And they started realizing that the social determinants of health were important, because most of the money before was poured into biomedical research. So we were funded to do this initial cross section. We got around 4,500 people, and then in 2019 we got to 887, and right now we have boosted this number to 10,000 people in 2023, because the idea being social determinants of health are important. And what we have done is we've linked the health records from the Ministry of Health with our survey data, so we can actually look at diagnosis, hospitalization, length of stay, and how much they paid for their visits. The only thing we don't get is GP visits, visits to private clinics. So one of the things that I wanted to show here, actually, if you look on this side, is if you look at length of life and quality of life and health outcomes, you'll see that the physical environment has 10% influence over length of life and quality of life. Social and economic factors contribute 40% in terms of prediction, clinical care 20%, and health behaviors 30%. So what we try to do in our survey is to collect information on all of these factors to try and tease out what is driving poor health outcomes in Singapore. And one of the things that we do is we work very closely with our aging planning office, and we actually co-designed the questionnaire together. And this is our agency for integrated care, so looking at long-term care. And our urban redevelopment authority, looking at environmental design. And there's a lot of work now looking at green space and psychological well-being. So the study that we are running right now is really focused on the social determinants of health. So how do you measure loneliness? Well, the most common way is to use the 3-item loneliness scale that was developed at UCLA. There's a 20-item version of this, but they found that the 3-item version worked just as well. So the first question is, how often do you feel that you lack companionship? And we translated this into Mandarin and Malay and Tamil. And you could say always, fairly often, occasionally, rarely, never, don't know, refused. The second question is, how often do you feel left out? Left out of activities, and the third question is, how often do you feel isolated from others? So we coded the don't know and refused as missing, and we dichotomized the measures into lonely or not lonely. So lonely meant that 2 or more of the responses were occasionally or higher versus not lonely. How do we measure hand grip strength? This was actually work with a colleague from Japan, Professor Yasuhiko Saito at Nihon University. He was working with us to collect information on grip strength. So apart from the social aspects of aging, we also collected information on BMI, grip strength, gait speed, chair stand, and blood pressure. And today I'll just be talking about the grip strength. And so while standing, respondents were asked to squeeze the dynamometer as hard as possible and then let go. We conducted it twice on each hand, and we measured based on mean of 2 measurements on the dominant hand. A colleague of mine then took this data and revised the normative values for grip strength in Singapore because it's lower than in the West. So that was an interesting exercise as well. This is the paper that I'm referring to. So in the analysis that I'm going to present today, weak or low grip strength was defined as the lowest 20th percentile, and we tested both a dichotomized variable and a continuous variable. We did linear and logistic regression models with hand grip strength at wave 2, and we looked at loneliness at wave 1 as the key explanatory variable. So you've got 2 waves of data, you've got loneliness at wave 1, hand grip strength at wave 2. And we controlled for the following: age, sex, ethnicity, education, housing, living arrangements, number of health-related limitations, ADLs, IADLs, chronic conditions, social network. And we did weighting for attrition. So what did we find? Well, we found that being lonely at wave 1 was associated with weak hand grip strength at wave 2 when we dichotomized it. So if you were lonely at wave 1, you were 1.7 times more likely to have low grip strength at wave 2. But interestingly, this result was driven by the men. So these are the results for the men. And you'll see that if men were lonely at wave 1, at wave 2, they were 2.2 times more likely to have lower grip strength. This was not found for women. So there was no relationship for women between loneliness and hand grip strength over the 2-year study period. So that is interesting, and we're going to actually be looking into the gender differences some more. So the conclusion is that loneliness predicts lower hand grip strength over a 2-year period. And what we think is happening is that there are gender differences in roles. So older women are more involved in housework activities, and they're more likely to go out and be social. Whereas in Singapore, when older men retire, they're less likely to make new friends, go out and engage in social activities. So what the results suggest is we need to engage older men to be more active in order to improve health-related quality of life in old age. So that is basically my presentation, and I'm happy to take questions later. Thank you.